Hello.
Hello.
Welcome, everyone. I'm really thrilled to see you all here this morning for this very important conversation. I'm Dr. Shoshana Ungerleider, a practicing internist at Crossover Health, the host of TED Health, and the founder of Endwell, which is a nonprofit focused on making the end of life a part of life. And this morning, I have the honor of speaking with Alexis McGill Johnson on the role of the health industry in building access to care and keeping abortion and healthcare one and the same. Alexis is the president and CEO of Planned Parenthood Federation of America and the Planned Parenthood Action Fund. Planned Parenthood provides vital health services to 2.4 million people each year through more than 600 health centers across the country. Their vision is a world of equity, where sexual and reproductive rights are basic human rights, and where access to healthcare doesn't depend on who you are or where you live, and where every person has the opportunity to choose their own path to a healthy and meaningful life. Alexis holds degrees from Princeton and Yale universities and has taught political science at both Yale and Wesleyan. She's the proud mom of 2 daughters. Welcome, Alexis.
Thank you, Shoshana. It's so good to be here. Thank you. Thank you.
Alexis, can you give us a sense of what's happening in terms of access to abortion right now in this country?
Yeah, so as you know, with the Dobbs decision in June, many states moved very quickly to ban access to abortion. We are at 18 states right now that have total or near total bans, which means that nearly 1 in 3 women is living in a state where they won't be able to have access to abortion care. We've also seen, as of last Tuesday, a majority of Americans push back in 5 ballot initiatives, yes, in 5 states, and then 6 including Kansas, that is really demonstrating that, this tension between kind of how healthcare is, essentially becomes so incredibly politicized at the state level now that we no longer have a federal protection to accessing abortion.
And what are you hearing from practicing clinicians on the ground as a result?
So this is the devastating thing. So we've been seeing, obviously, since SB 8 went into effect in Texas, which for many of you all know was a 6-week abortion ban that also included a bounty hunting provision attached to it as a way to enforce what then was an unconstitutional law. And, and what we saw were providers everywhere who had been turned into, call centers, providers who were terrified. We've seen chaos across the states, patients making appointments for abortion services only to find out that, a ban has gone into effect and now they have to travel on average 400 miles one way in order to get access to care. We have seen providers have to literally train themselves on the law. So doctors becoming lawyers, and I guess politicians are becoming doctors, so now doctors can become lawyers, as a way to essentially determine whether or not they are being compliant. I've seen patients, Shoshana, and providers literally reaching into their desks, to take the lunch that they brought from home, the snacks that they've had on hand, and give them to patients as they begin on these journeys. And so it's just chaos, it's confusion, and and a lot of fear. A lot of these penalties in many states with total abortion bans or near total abortion bans are fines that include things like, $100,000 penalty, up to 99 years in prison. We're talking about loss of licensure. And so the fear of just being able to provide care, knowing whether or not you could do a telehealth call or not, all of that has been essentially brought into the space, which is really incredibly awful.
Oh, it really is. So for a long time, abortion has been framed as a political issue. I think a lot of us here, myself included, would say that it should be viewed as a public health issue. And so how might we as individuals, and certainly as a society, reframe this conversation and make sure we're focusing on the issues that matter?
Yeah, abortion is healthcare, right? I think we should say abortion is healthcare over and over again, because that's exactly what it is. Yes, we can clap for that. Yes. And, healthcare, as we also know, has been very politicized, right? And so people see it as this separate, kind of healthcare in ways that we don't politicize we don't politicize vasectomies, right? We don't politicize Viagra. We don't politicize many things that impact, reproduction from men. But it's also, it's an economic issue, right? It is it's a justice issue. We see people who are most impacted by these bans are people of color. They're Black, Indigenous, people of color, rural communities, LGBTQ communities, people literally with the least, living at the margins of society in terms of transportation, in terms of access to healthcare generally. And then we are layering on forced pregnancy on top of that. So I think you're right, we have to expand the way we talk about this as a public health issue and the impact that it has forcing people into pregnancy and how that impacts their ability, to stay out of poverty and many other issues.
So building on that, I want to talk a little bit more about how abortion access is connected to the health of our communities, right? Across so many dimensions, not only medical care, but also, as you said, economic participation, family stability. Can you talk about the ramifications of lack of abortion access in these areas?
Yeah, so look, it should be no surprise, right? Many of the states that have enacted the most restrictive abortion bans are also the states that have the highest maternal mortality rates. They're also the states with the highest infant mortality rates and the lowest child well-being. So what we are seeing again is a layering on. Pregnancy itself is a very complicating process, right? And we know that Black women are 3 times more likely to die than white women in just childbirth or childbirth. And so, the idea that we are now layering on additional restrictions that have financial consequences, that have social consequences, that have, again, justice and health consequences is incredibly challenging. And I think that's really where, we've been trying to draw attention, right? That it is the case that so many people who are making these very individual personal decisions, as we know, do not want government to be involved in that. There's no room for the politician in the exam room to help them make that, especially when it is a life and death situation. We also have seen over the last year, and it's become, I think, more prevalent now post Dobbs, is the confusion that many providers are having around, also treating, things that are happening with intended pregnancies, right? Yeah. Patients whose pregnancies are no longer viable, who now have to leave state in order to get access to care. Otherwise, they will go into sepsis, right, or go into septic shock. The implications for things like IVF, the implications for birth control, all of these things have now come to the fore because of the Dobbs decision in ways that we haven't really actually parsed out the impact.
Yeah, it's complicated. In talking to my colleagues around the country in these states, it's total confusion and a lot of despair around it all.
Absolutely.
So many people in attendance here today work in the private sector. We've seen a lot of companies providing the option for free travel to receive abortion care. What more can the private sector do to make sure that their employees have access to these critical services?
Well, I love this question because I think it is so important. First of all, thank you for any company in the room who has stood with your workforce, immediately set up a policy to support your workers, to ensure that they are able to get out of state, in their travel benefits, in their healthcare benefits. All of that I think is incredibly important because what you did in standing with your workers was also demonstrate where you sat on the issue, which is, no companies, I think private companies in particular, can afford to become neutral in this moment. And we have heard from so many people. I've heard from so many CEOs. I've heard from so many C-suite executives, as well as members of ERGs who are trying to figure out what they can do in order to that. So I would say supporting your workforce is incredibly important. I also want to see you support your consumers and the communities in which you live. You have a choice about where you do business, about with whom you do business, about what that looks like in every single state. And too many companies are supporting incredibly hostile lawmakers that are willing to essentially create legislation to turn us into second-class citizens. And I think it's really important that you stand with your values in this moment. I also think it's incredible for many private sectors, particularly in a community like this, to partner. Right? We are in a moment now where we are going to have to solve even bigger challenges related to access, not just to abortion care, but all of the other implications that I said are going to be impacted. So partnering around innovation. Planned Parenthood as you said, sees over 2 million patients every year. 200 million people come to our website every year. We have, we do a full range of sexual and reproductive health care, and now increasingly are moving into things like behavioral care and mental health care, because those are adjacent to the communities that we filled as the largest sexual and reproductive health provider, but also the biggest public infrastructure across all 50 states. And so I think it's really valuable for us to have partnerships, to have ways to push on innovation, to have ways to connect communities that we know are going to continue to be marginalized by this lack of access to healthcare broadly, and certainly because of these bans that are happening that could be upwards of 25 states in the coming year.
Wow. So there's been a lot of talk about women's employment, especially in places with reduced access to abortion. A lot of people, again, in this room manage large staffs of people. How do you think we can address the inevitable decrease in women's participation in those states in the workforce as a result?
Look, 1 million women have left the workforce since the beginning of the pandemic, right? I mean, it is had an incredibly devastating impact on our ability to participate in the economy. And we know that one of the biggest factors of our ability to stay in the economy is our ability to plan when and if it is the right time to become a parent, right? Most people who seek access to abortion care, and that is 1 in 4 women before age of 45, already is a parent, has already built a family, and they're making decisions about whether or not this is the right time to add to the family or whether their family is complete as they see it. And so in taking away this right, we have impacted also people's journeys throughout the economy. We know it will impact the economy upwards of $1 billion annually. We know that so many of our gains have come because of investments around things like contraception, our ability to earn. So, I think we have to continue to connect the dots, not just that making an individual decision is an economic decision for many people, but also the fact that not having the access, the ability to plan if your future also has an impact on the economy and where we sit. And so I think it's really important that we continue to hold those things together and understand the implications broadly.
Mm-hmm. So recently there's been a surge of misinformation and disinformation on social media and all other sorts of media as it relates to health, specifically abortion care.
Yeah.
As people in the health sector here, how can we push back?
It is shocking what is online, I have to tell you.
It is.
I mean, and as someone, I live in this is my business. My 13-year-old, she's going to kill me for saying this, but literally my 13-year-old just got her period. And I'm sharing with you all now, everybody.
I love it.
And, I went online to help her, understand, all of the range of activities, things she should be doing, how she should be thinking about it. And what came up was so horrifying. It was so misleading. And, I sent her to the Planned Parenthood website, but I also wanted to understand broadly what is the kind of information. We have seen this time and time again, the weaponization of misinformation in order to stigmatize access to abortion care, but really sexual and reproductive care broadly. And so we need partnership again to help people understand how your body actually works. We see this misinformation get built into policy, which then gets built into all of these bans and other things. We have seen these crisis pregnancy centers that show up right next to Planned Parenthood health centers, the same branding, and they let patients go in, and they counsel them as if they're counseling them to get access to abortion, and really all they're doing is shaming them and stigmatizing them. So, again, one, we need help fighting misinformation, we need help fighting all the bots and those sorts of things, but we also need, for people to understand and expose the actors that are really bad in trying to drive, essentially inequality. We wouldn't have these bans, we wouldn't have these laws if people actually believed we were equal. And so we have a cultural challenge as well that we need to ensure that I think many people could be partners on.
So what do you need from the public and from supporters right now?
Well, there are people who need support. So there are many people who are making abortion journeys, literally, as I said, 400 miles one way in order to get access care. These are the people who are leaving their shifts on a, at the end of the day and driving upwards of 11 hours to get access to care. It means they need child care, they need elder care because they're probably sandwiched. It means that they need access to hotel rooms and gas money. So partnerships there, resources that go to things like local Planned Parenthoods, abortion funds, independent providers. Those are the places where, from a treasure standpoint, it would be incredibly important to see. I think it's also really important, again, as leaders in the healthcare industry, to continue to normalize the fact that abortion care is healthcare, to continue to help us support kind of conversations now that we have to actually fight state by state, right? We may have abortion may have saved democracy last week, and in fact, it still didn't change the access that we need to see right now. And so I think it's really important, again, as private citizens and also as private companies, to make your voices heard in the ways in which you do or do not support either pro-choice champions or essentially, ensure that these people who are so hell-bent on going back to, the 1800s are not the people that continue to drive legislation around abortion access.
So you've had a busy last few months, probably a busy last few years. How are you doing?
I have to say, I appreciate the question. I actually feel really energized by last week, I have to say. It has been devastating to be in each state, meeting with providers who are exhausted. They are doing everything they can, meeting with litigators who are fighting in every single state because they know if they just win one injunction, it's going to allow, a number of patients to be seen that day. And so, the day-to-day work of what it means to actually provide abortion care in a country that already had an infrastructure that was decimated is incredibly challenging. But I am also I think about all of the stories that I've heard from patients. People come to me, I say I'm the president of Planned Parenthood. People share their stories with me. And, while they are despairing, they are not living in despair. They actually are living in hope. And that hope, I think, is something that I think continues to drive, it continues to propel not just me, but our staff, our supporters, our volunteers, because, my favorite Alice Walker poem is, "Hope is a woman who has lost her fear." And that's what we are seeing over and over again. People who are being unafraid, who are being unapologetic, people who are telling their stories, people who are really understand the importance of what it means about your own bodily autonomy in terms of, driving what your future possibility could be. And that, I think, however tired I might be, however exhausted my staff is, we still have these stories that live with us and that really drive and ensure. And I think that really is, so many healthcare stories.
So speaking of hope, you have 2 young daughters.
Yes.
What are you most hopeful for the future?
Well, first, I'm terrified, right? I'm now living in a world where they have fewer rights than I do.
Yeah.
My older daughter was on the bus to camp the day that the Roe decision came down, the Dobbs decision came down, overturning Roe, and she texted me immediately and she said, Mom, I am so sorry that this happened. I know you've been fighting so hard, but it's going to be okay. We're going to continue to fight, right? We're going to continue to fight. Yeah. And so I'm hopeful that we're passing on to the next generation. Part of what we saw last week was young people. I mean, God, the fire on college campuses.
Yep.
They're like, oh no, not only do we want to control our own bodies, we want to control our own information about our own bodies. We want to control how that's used by health insurance companies and technology and whatever. They are very clear about bodily autonomy, not just being about the kind of care that they can get in state, but also who gets to profit off of their bodies and whose values they align with. And so I'm incredibly hopeful watching Gen Z. I'm incredibly hopeful watching my kids. And again, the number of stakeholders that have come into a conversation that has really traditionally just been, a group of, maybe radicals, somewhat mainstream feminists, having this fight. And now everyone understands that abortion is your business too, right? Abortion affects men. Surprise. Abortion affects companies and workforces. It affects universities. It affects, all of these folks who are really didn't think that this was their issue.
Yep.
And now they are showing up, and they are seeing also the link to again, our democracy, right? The very first sign of descending, I would say, into an authoritarian regime is taking away control from women to control their own bodies. And that rejection, that very blatant rejection last year, forget where you are in party lines, the only way we got to where we were is because people saw a link between abortion and democracy and understood how important it is to have the ability to control your own body and the ability to express your voice and your vote in a way that's where the majority of people are. So that gives me hope too, because without those two things, we won't be able to stay free.
Absolutely. Thank you so much, Alexis, for this conversation, and thank you all for joining us today.
Thank you. Thank you.
Thank you for sharing your thoughts, Alexis and Shoshana.